Is salicylic acid a exfoliator? Is that the purpose of it?
Salicylic acid mainly works to unblock the pores, not necessarily to take skin layers off. So I wouldn't call it an exfoliator, but it's an excellent anti-acne ingredient. Benzoyl peroxide also decreases inflammation and can unblock pores. It's not necessarily an exfoliator as well. But if you're looking for an exfoliator or a toner or a astringent, all being essentially the same thing, you can go with a glycolic acid wash. Mm-hmm. And for a teenager, I wouldn't really push them too early to do that, but when they get to 16, 17, you can have them start using glycolic acid washes as a toner to help take off the excess skin layers and prevent skin blockage, skin pore blockage, I should say.
With cleansers, toners, and the other things that you mentioned, moisturizers, is it true that you get what you pay for, or do you overpay for things sometimes when you buy it at the department store cosmetic counter versus if you buy it at the local drugstore or supermarket?
That's an excellent question, and that's a question I get every day in my practice, where somebody buys a brand name that's very expensive and they think it's better because they bought it at such a high price, that it should work better. The things that you can buy over the counter, the products that you can buy over the counter, are mainly either salicylic acid, benzoyl peroxide, glycolic acid, or lactic acid, and different percentages of such. They may come in different formulations where some are more moisturizing than others, but essentially the active ingredient is going to be the same.
Is more better when it comes to those percentages of the active ingredient?
Not necessarily, because the higher you go in a lot of these chemicals, the more irritating they can be. And the more irritating they are, the less likely you are to continue using them. So you want to find a low percentage product that you are comfortable using that doesn't irritate you. And you don't have to break the bank in getting it. You can get a Neutrogena product, you can get a Clearasil product, an Oxy 10 product. And just because it's not expensive doesn't mean it won't work well. It actually worked very well.
Well, when your patients start to become of an age to wear makeup, girls of course, although I suppose maybe some of the guys are interested in that too, what do you suggest? I know that much is made now of, and I don't think I can pronounce it properly, so I'll let you, the formulations that don't clog pores,
comedogenic.
Comedogenic.
Yeah, and that's C-O-M-E-D-O-G-E-N-I-C. And you want to find products that are non-comedogenic. So comedogenic just means acne-forming. You want the non-acne-forming makeups. The brand that I tend to recommend the most is actually Clinique. They scientifically prove their makeup to be non-comedogenic. There's also Neutrogena that has a makeup line. And those are the two that I tend to recommend the most. A lot of people ask me about Lancome and prescriptives and Bare Minerals and Bare Essentials, and those are fine. If they don't cause acne for you, go ahead and keep using them. There is a brand that I, as well as other dermatologists, tell young females to avoid, and that's MAC makeup. And hopefully, people from MAC, hopefully people from MAC aren't watching this and saying, let's keep people away from him. But MAC makeup tends to clog pores, and I've seen it time and time again, and confirmed it with my colleagues. So I tend to tell people to avoid that brand of makeup. But if you stick with Clinique, Neutrogena, Lancome, prescriptives, you should be okay.
I know that there's an ingredient that is sort of insidious that does cause clogged pores, and see if I correctly recall it, isopropyl stearate. Is that the bad ingredient that you find? You have to look for it and make sure it's not in your product? There's
that, and there's a host of other compounds that can also cause pore blockage and cause acne. So what you want to look for is just essentially the non-comedogenic label. Because a lot of people might have trouble remembering that one, but if they know it's non-comedogenic or proven to be non-comedogenic from a brand that prides itself on that, they can feel pretty comfortable that it's not contributing heavily to their acne.
We have so much more to discuss tonight on our topic of skin, including skin diseases, some of which can be extremely serious and aggravating and take a long time to clear up. So stay with us here on HEALTHline. You're back on HEALTHline. I'm Suzanne Whatley along with Gregory Zarian, and our guest, Dr. Don Mehrabi, was informing us about acne and the treatments that he recommends. And I wanted to ask you, what do you do with the guys? You were lucky enough not to have acne as a kid, Gregory.
But
it's you know, if you weren't so likable, I'd hate you for that.
beauty is as beauty does. Acne in men, common teenagers?
Very common. Very common in teenagers.
And as you said earlier, you grow out of it. But now, what about acne for men as an adult? Where does that come from? Is it body changing, stuff like that too?
Well, there's a couple different causes for acne in adult men. So I'm assuming we're talking about men who really didn't have acne when they were younger.
We're talking about you, Gregory. Okay, well, you know, if you want to point fingers, go ahead.
No, not pointing any fingers, but let's assume we're talking about men who really didn't have problems with acne throughout their teenage years or their early 20s. There's a couple causes. One of the obvious ones being steroids.
Okay.
If there's a guy who works out at the gym a lot and tends to take any kind of anabolic steroids, that can cause acne.
You know what that is, right? The bodybuilding stuff, okay.
Yeah. So that's
for muscle building, but
right.
It does have its side effects.
Right, because it raises the levels of testosterone, and as we talked about, hormones are a primary cause of acne. So anytime you raise testosterone levels, you do have a chance of getting acne. So that being aside, for most of the other people who don't take steroids and who are guys who haven't had acne in the past, stress plays a big role.
Really?
Very big role in acne. There's also other conditions that may cause acne that may be confused with the acne that we talk about in teenagers, one of which is rosacea. So there are adult males who have rosacea. Rosacea is a condition where you have the red rosy cheeks, also can affect the nose, the chin, the central part of the forehead. And if it progresses, it can give you acne-like lesions. So that's another condition that you have to think about. And then, of course, you know, things like some guys, they'll wear makeup, of course, if it has to go with their job and such, and that can cause a physical blockage that gives them acne.
But here's my question with rosacea and stuff like that is, if you didn't have it as a teenager, then all of a sudden you start getting rosacea or adult acne, is it hereditary? Is it your body's just finally saying, okay, welcome to blemishes?
Well, we discussed that acne can be hereditary, and rosacea definitely is hereditary. And yes, you can get it as an adult. In both cases, yeah, it can start later.
What about other diseases like psoriasis and eczema? What are they, and are they related? How do you treat them? I've been blessed with not having to encounter either one, but I know people who have had them and have been plagued with them for years.
And can I add one thing? When my mother gave birth to my twin brother and I, one of the beautiful side effects of having twins was psoriasis. And it affects your immune system, right?
Well, psoriasis is caused by the immune system. It's a misregulation of the immune system.
She hated us for that.
Well, she was under a lot of stress. I mean, I had two kids, but I had them one at a time.
I didn't do it. That was a miracle. So how does that happen? Suzanne also said eczema. What is that?
Well, both of those conditions, psoriasis and eczema, are genetic conditions. Let's take psoriasis, for instance. It's actually one of the most studied skin diseases. There is a genetic predisposition to psoriasis. It obviously follows in families. And in both cases, same with eczema, there is a genetic predisposition, but we don't have the genes that they lie on. So we can't target those genes or give you the likelihood of getting it, like for your children and for your grandchildren and such. However, both are genetic conditions. They're both inflammatory conditions that are caused by a dysregulation of the immune system. We can target specific cells. We can target specific inflammatory markers with the new medications that we have out that are very specific to those individual conditions. Primarily, the work has primarily been done with psoriasis. We don't have a lot of those specific drugs for eczema, but I'm sure it's in the pipeline at some point that they're going to create antibodies and such to the inflammatory markers to actually decrease eczema.